Hi, welcome back to the All Things Homeopathy Clinical Case Series. I'm Dr. Larry Malerba. In the last episode, I presented Case 10A, which was about a man with chronic anxiety and vertigo. Today, I'm going to analyze that case and let you know how treatment went. So if you haven't watched the previous episode, I recommend you go back and watch episode 10A before watching this one. Okay, so let's jump right in. So as you may recall, Stephen had two main problems. One was anxiety and the other was vertigo. The vertigo had begun 6 years prior, and it was accompanied by an intensification of his pre-existing long-standing anxiety. Now, I thought it would be an interesting exercise to repertorize the two problems separately.
So I first repertorized all of Stephen's many fears and anxieties. The fact that there are so many fears places the center of gravity of the case squarely on the mental plane. As you can see, I included anticipation here because it represents a type of anxiety. Then I combined these two rubrics to represent fear of public speaking. Anticipation, stage fright, and timidity, appearing in public. And I included anxiety about health here. This appears to be Stephen's biggest problem. The rest of the fears are pretty straightforward. We have fear of crowds, flying, bridges, death, heights, hospitals, suffocation, tunnels, and water. Then I added passion for gambling for good measure. And finally, I added superstitious here, because Stephen said that he blows little things out of proportion, and he gave the example of watching TV commercials about childhood cancers. It's hard to believe, but surprisingly, there are two remedies that cover almost all of these symptoms. Argentum nitricum has all except fear of water and passion for gambling. And arsenicum has all except fear of bridges and fear of tunnels. Aconite comes in third place, followed by sulfur, stramonium, and lycopodium. Okay, now let's distill this list down to the most prominent fears and let's see what happens. In this repertorization, I simply included all the fears that I underlined 3 times. As you can see, that includes anticipation here, a combination of rubrics for public speaking here, anxiety about health here, fear of flying here, fear of death, and finally I chose 3 rubrics to represent fear about medical things: fear of medical exams, fear of the physician, and fear of hospitals. Again, we see the same 3 remedies repertorize out the strongest, but this time in a slightly different order. Argentum nitricum is first, aconite is second, and arsenicum comes in third place. Okay, now let's repertorize just the vertigo symptoms and see what we get. Now recall that Stephen noted that his vertigo originally started when he got out of bed one morning. The other clue was that he said it felt as if he was on a boat, swaying to the right. As you can see, I chose 3 rubrics to represent the first clue: vertigo in the morning on rising, vertigo in the morning after rising, and vertigo on rising from lying. And for the second clue, I combined vertigo with a tendency to fall to the right and vertigo swinging sensation to the right. Separately, I added vertigo as if floating as the best approximation of the feeling of being on a boat. Interestingly, aconite comes out at the top. The other two remedies, argentum nitricum and arsenicum, do not key out. Okay, now let's focus on the potential etiology of this case. Remember now that Stephen had breathing problems as an infant. He was in an incubator at birth, and it was discovered that he had a cyst in his airway. A tracheotomy was performed in order to allow him to breathe while the cyst was removed. It's quite reasonable to think that most of his fears may be related to this very early childhood trauma. So with this in mind, I chose the following rubrics. Ailments from fright here, and then I combined asphyxia in children with asphyxia in newborns here. And lastly, I chose asphyxia from suffocation here. Now, technically speaking, it appears that asphyxia did not actually take place, but I was curious to see what remedies would come up. And as you can see, aconite covers all of these rubrics. And arsenicum covers some of them here. So now let's review our findings. When we include all of Stephen's fears, argentum nitricum, arsenicum, and aconite come up first, second, and third. When we include only the strongest fears, we get argentum nitricum, aconite, and arsenicum in that order. Of these three remedies, aconite is the only one that shows up in the vertigo repertorization. And when we looked at etiology, aconite was near the top, as was arsenicum. Therefore, aconite is the only remedy that prominently covers the three main aspects of this case: the fears, the vertigo, and the etiology. Clearly, this makes a very strong case for aconite as the best choice of remedy for Stephen. However, I did not prescribe aconite, and let me explain why. I gave this case a lot of thought. I was admittedly torn between aconite and argentum nitricum. It would have been perfectly reasonable to choose either remedy, or even arsenicum for that matter. But I ultimately chose argentum nitricum because of the feeling that I got from Stephen. He was chronically anxious about his health, but I didn't get the feeling that he believed he was going to die immediately in the short term. And this is what we would expect with aconite. Aconite fears that death is imminent. Neither did I get the feeling that I get when I see an arsenicum patient. Stephen wasn't particularly finicky or fastidious or tidy, like one would expect from an arsenicum type. But I did get the impression that Stephen was rather expressive, almost too much so. Even though he described himself as introverted, in actuality he was quite open and eager to talk. He spoke in a free-flowing way about his problems and his history. And that's the feeling that I often get when I see an argentum nitricum case. They tend to impulsively blurt out the first thing that comes to mind. They have less of a filter than most other remedy types. So for these reasons, the combination of fears plus the overall feel of the case, I chose argentum nitricum. Now let's take a look at how the case turned out. 3 weeks after taking 2 doses of argentum nitricum 30C, Stephen reported the following. The next day I had the worst migraine that I've had in a long time, but my anxiety has been better. I made it through the first 10 days of school without taking Xanax. That's a definite improvement. In addition, he noted the return of an old symptom that he hadn't had in almost 10 years. He was having diarrhea soon after rising in the morning, but he didn't feel anxious about it like he did in the past. The anxiety is markedly better. The vertigo was also better in the sense that he didn't have any prolonged episodes. He did confess, however, to having 2 cups of coffee. Now, if it weren't for the coffee, I would not have prescribed another dose. I would have just waited because the remedy was working. But I was concerned about a potential relapse due to the coffee. So I told him to wait another week before taking 2 more doses of Argentum nitricum 30C. 4 weeks later, Stephen said, "It's pretty impressive." While his anxiety was originally an 8 or 9 out of 10, he now rated it as a 2 or 3. My stomach has settled down. He was only occasionally waking at 4 a.m. to have a bowel movement, like years ago. The vertigo is improved for sure. And I knew for sure that we were on the right track when Stephen said, "I'm really enjoying teaching." Clearly, he was progressing, and so there was no need to repeat the remedy. I sent him home with a couple more doses with strict instructions not to take them unless he felt his anxiety getting worse. Stephen called 3 months later saying that the anxiety had acted up approximately 6 weeks after his last visit. He therefore took the extra doses of Argentum 30C at that time. He subsequently improved again, but not as completely as with previous doses. I suspected that this setback may have been related to the fact that he had also decided on his own to discontinue taking his antidepressant Zoloft. He hadn't taken any for over 2 months, and there was still some mild lingering anxiety. I decided that it was time to increase the dose. I prescribed Argentum nitricum 200C to be taken only once. 5 weeks later, Stephen said, "I've come a long way. The anxiety has really improved. I can think about getting on an airplane. I had no digestive issues. My vertigo is just occasional and very mild, and I haven't taken any Zoloft or Xanax." He also noted that he came down with a 48-hour virus about a week ago. "I had a sore throat and I lost my voice. Weirdly, while I was sick, my vertigo and anxiety were completely gone." In a matter of 6 months, Stephen was practically a new person. I sent him home with another dose of Argentum nitricum 200 to be taken only if needed. And I haven't heard from Stephen in the 2 years since. Okay, now let's talk about a few important points here. First of all, there was an obvious initial aggravation that preceded Stephen's improvement. Stephen called it the worst migraine he'd had in a long time. Although it may not have been pleasant for Stephen, an initial aggravation like this is often a confirmatory clue that the correct remedy may have been given. Secondly, I hope that you've noticed Herring's law in action here. Stephen started out with anxiety and vertigo, and as those problems quickly diminished, they were then replaced by an older, less threatening digestive problem. Months later, Stephen noted that all of his chronic symptoms completely disappeared when he came down with an acute case of laryngitis. Now, what's so striking here is that all of these problems are well-known stages of symptomatology of Argentum nitricum. Argentum nitricum is known for its debilitating anxiety, its digestive problems, and a tendency to get laryngitis. As Stephen's health improved over time, he found himself traveling back in time through old symptoms and through progressively milder and less threatening symptoms, all of which are well-documented symptoms of Argentum nitricum. Here we have a wonderful example of how Herring's law can work. One final point that I want to make is that I often find myself wondering what might have happened had I given a different remedy. It was very tempting to prescribe aconite in this case, but I didn't. Is it possible that aconite could have worked? Could it have worked even better than argentum nitricum? Unfortunately, we can never know the answers to such questions. We can't conduct an experiment with two Stevens side by side, with each getting a different remedy. But what I can do is keep aconite up my sleeve as a possible alternative, just in case I ever hear from Stephen again. Okay, well, I hope this case was instructive. Let me know in the comments if you have any thoughts or questions. Don't forget to subscribe, and I hope you'll tune in again to the next episode of All Things Homeopathy. May the vital force be with you.